Okay, it looks like it's top of the hour. Thank you everyone for joining us today for this webinar. Just a few things before we get started. Feel free to enter questions into the chat function during the webinar, and we'll try to get to those at the end. And certificates will be available on Monday by downloading those from your account. And also, I'd like to share with you that registration is open for Medila's 15th Annual Global Breastfeeding and Lactation Symposium. And you can email education@medila.com for more information. And we're excited to have that symposium virtual this year. And the deadline for poster abstracts to be submitted has been extended to August 7th. And all the accepted abstracts will be given a complimentary registration. More information at the end of the webinar today. Irene, if you're ready to get started, go right ahead.
Awesome. Thank you, Kim. Trying to expand my slides, and they're not going forward.
If you want to hit the enter button.
I did, indeed.
Okay.
All right. Love this technical stuff. All right, so.
Maybe unshare and reshare.
Okay, let me try that. Here we go. Let's try this again. No, it's not working. Look at that. How fun.
John Benton, do you have any suggestions for Irene's PowerPoints not moving forward?
We're just waiting for some technical advice here in the remaining few moments while John might be able to figure out what's happening here. Love the fact that Murphy's Law is prevailing today, and you can see that that is in fact my maiden name. Attempted to do away with Murphy's Law years ago when I married an Italian. However, that still continues to be part of an issue. Yeah.
I'm not sure. John, are you available to assist with this?
All right, let's see if we can't figure this out ourselves. There we go.
Oh, there we go. Okay.
Awesome. Oh, terrific. We love it when things get resolved, issues get resolved. But as clinicians working with families, we're all aware of the need to punt occasionally. So thank you, everyone. Welcome. And it's truly a delight to be with you today to talk about an issue that many breastfeeding mothers experience, and that's nipple tenderness and or pain while they are in fact attempting to breastfeed. So in full disclosure, I am currently working as an education consultant for Medila, as I previously had full-time employment with Medila for almost 22 years. So just understand that that is my disclosure. The goals for this 30-minute presentation are to identify frequent causes of nipple tenderness that breastfeeding families experience and to describe effective prevention and treatment options for nipple tenderness. We'll start by looking at some statistics that we are all probably aware of about our current breastfeeding in the United States. But why do families not meet their breastfeeding goals? And that's important for us to understand as well. And then we'll look at some education as well as supportive measures that will assist with this issue of pain or nipple tenderness. So I'd like to start by looking at what our current breastfeeding rates are in the US. And the CDC 2020 report card, which actually looked at data from 2017, identified that 84.1% of US families actually initiate breastfeeding. And this rate of breastfeeding initiation really speaks to the enormous effort of public health agencies, medical and nursing organizations, as well as our lactation community to educate families about the value of human milk and breastfeeding. And families have heard this message and they clearly want to breastfeed. But when you look at the numbers of families exclusively breastfeeding their infants at 6 months of age, only 25% of families are meeting their breastfeeding goals. And clearly this means that something is happening and something's getting in the way of families meeting their breastfeeding goals. As I said, this is data that's collected from 2017, and it will be very interesting and probably not surprising to learn what the breastfeeding statistics will look like for 2020 amidst the coronavirus pandemic. And we'll address a little part of this impact certainly later in the presentation. So the big question is, bear with me, there we go. Is why families aren't meeting their breastfeeding goals. And the research identifies, and this isn't surprising to any of us on this call, that the number one reason for not meeting breastfeeding goals is insufficient milk supply, whether this is actual or perceived by families. And the reasons for this are multiple, and we could spend a whole hour on why this is happening, and certainly strategies that would help to prevent it. But our talk today is about the second most commonly identified cause for not meeting breastfeeding goals, namely sore, tender, or painful nipples. It's a common, real problem for lots of women, and it's cited as one of the main reasons for the cessation of breastfeeding in the early postpartum period, while later on, low milk supply is often seen as the reason to actually stop breastfeeding. These are some difficult pictures to actually look at, and we can appreciate the pain associated with this type of skin or nipple trauma, and that a woman experiencing this type of trauma to her nipples would want to stop breastfeeding. Nipple pain, increased nipple sensitivity, and or trauma associated with breastfeeding is real and it's common. And if you just look at the dates of these publications, you'll see that lactation professionals and these clinical papers have discussed the issue for years. And yet the issue is still with us. The incidence of nipple pain and or trauma varies between 34 and 96%. 16 to 79% experience nipple soreness in the first week of breastfeeding. And it's been reported to occur from the 2nd to the 15th day, with the height of nipple soreness occurring between days 3 to 7. Treating sore and or traumatized nipples quickly and effectively needs to be an important factor in helping families breastfeed by maintaining a pleasurable breastfeeding relationship between them and their infant and preventing further complications such as infection. And you can see actually through all three of these images that infection might be a secondary problem for any of these nipple conditions that we're looking at. We do have more recent data about breastfeeding problems and looking at nipple soreness. Researchers continue to study nipple pain as a common problem for breastfeeding families in spite of all that we've learned about preventing it. And this is a report of a 2018 cross-sectional study of 1,437 mothers with full-term singleton infants. It was a mixed method approach used to analyze their post-birth survey data about their breastfeeding experiences. And the researchers reported that up to 40% of mothers experienced early breastfeeding problems, with 38% reporting sore, wounded, and cracked nipples. And in this Italian study of 552 mothers, again published more recently, this in 2019, around 70.3% of mothers experienced breastfeeding difficulties, and they reported cracked nipples, perception again of insufficient milk volume, pain, and fatigue. And difficulties occurred mostly within the first month, with 63% of mothers reporting occurrence in the first month of breastfeeding. Of this group of mothers of 552, 159 reported cracked nipples. And we certainly understand that many of the causes of nipple pain are different from latch and attachment. We can see them with nipple anomalies. I will say mothers' own anatomies, such as flat or inverted nipples, infant sucking action that causes friction, excessive nipple movement inside the infant's mouth, when the infant has ankylosing or tongue tie, the palatal anomalies like bubble or arched palates, strong suction of the infant has a really strong suck. We see this nipple soreness with milk blisters or blebs, and we see it with infections with moms who may have staph or even candida. And often we see nipple pain or tenderness with moms who have a history of psoriasis or dermatitis and even Raynaud's phenomenon. But interestingly, insufficient milk supply may be actually a secondary effect of nipple pain as a result of inhibition of the milk ejection reflex due to pain or ineffective removal of milk, as with an infant who has tongue tie or a cleft palate. So we see a couple of variations of treatments here. Nipple shields are often cited as suggested in the research or the literature to decrease tenderness while breastfeeding. And they are often used to improve breastfeeding comfort while the mom is experiencing that tenderness. And the picture image on the right is of a silver cup, and silver has been suggested as a treatment measure as it provides an antimicrobial environment for nipples to actually recover. I looked through the literature about nipple cups because I had not seen them used. I've heard about them, I've seen them at conferences, but I had not really experienced them with mums directly. And there was an Italian study actually published in 2015 that looked at the use of nipple cups in between breastfeeding sessions with moms who actually were symptomatic with nipple fissures versus moms who were treated with routine or science-based care, routine postpartum care. And in the moms, and those were 40 moms, of the 20 moms that were in the experimental group, they actually had a significant and more rapid resolution of their painful symptoms using the silver cup compared to the moms that had in the control group that had the usual treatment care. And the silver cups were well tolerated by the moms who actually use them. So they might be something that you might be able to incorporate in your practice. I have seen them, as I said, at conferences, but not in practice myself. So really, finding the source or the cause of the nipple tenderness is paramount to managing this issue of soreness or nipple pain. And when we talk about prevention, we need to consider correct positioning and attachment or latch. Correcting infant position and latch are the most common experience-based recommendations for treatment of nipple pain. And when they're corrected within the first week after birth, have been associated with a longer duration of breastfeeding and fewer breastfeeding problems, including sore nipples. And all of us could tell the difference between these two pictures of latch. And we know the difference between a correct and a poor latch and what they look like. But my question is, what do families know? Do they know the difference? Can they tell the difference immediately between a proper and an improper latch? And if moms experience tugging on their nipple, do they associate that with nipple pain? If a toe curling experience is associated with infant latch, really intervention is needed, because latch should not hurt other than the sensation that perhaps a woman has never experienced before of the tugging and the vacuum, the natural normal vacuum pressures of an infant on her nipple. So moms come in all shapes and sizes, and some of these shapes and or sizes may actually present more of an issue for that breastfeeding infant than others. And it's important for us to be cognizant of what language we use when we're seeing mother's anatomy, and be sensitive to negative comments about anatomies that are different. And babies love their mother's bodies, and they do adapt to variations in their mom's anatomy. But let's just be sensitive to the fact that we need to be cognizant of the language that we use when talking about, oh, that's a really large nipple. Oh, what a perfect nipple. Oh, that baby has to tug a little bit further to get that. Shy nipple out. I mean, that kind of language just is not helpful at all. So what about some types of nipple care? And what we've learned from research is that some practices that we once thought were helpful are actually potentially harmful. We actually can't toughen up the nipples prenatally. We attempted to do that. Many moms were instructed to toughen their nipples with perhaps even a dry Turkish towel or a washcloth several times a day. The skin would toughen. And I do know someone personally that attempted this. She was very vigilant about wanting to do the right thing, and her skin actually was abraded before she even delivered because of her vigorous attempts of complying and trying to do the right thing. So we need no cleansing technique for nipples prior to breastfeeding. The usual bathing practices are sufficient. We don't use alcohol, we don't use dry heat, we actually use moist heat for healing and for skin and maintaining skin moisture, is based on the practices of wound care, where we recognize the need to maintain or increase normal skin moisture in aiding to maintain skin integrity. So as I mentioned, a variety of interventions have been used to either treat or prevent nipple pain and or trauma with breastfeeding. And these include topical creams, solutions, sprays, oh gosh, time-restricted breastfeeding, exposure of the nipples to like dry heat again. But a real common one is the use of expressed human milk. And the aim of this 2001 study was to evaluate the efficacy of a specifically high-grade, highly purified lanolin versus expressed mother's milk for the treatment of painful and damaged nipples that were associated with breastfeeding. And this was a prospective controlled trial that evaluated 84 lactating mothers. 45 participants were allocated to the lanolin experimental group, and 30, or not experimental, but to the lanolin group, and 39 to the expressed breast milk group. And the data from this study actually showed that in this group of moms, a significantly better outcome for moms who were treated with topical lanolin, highly purified lanolin, as compared to expressed breast milk. And this benefit reached statistical significance for healing rates, nipple trauma, and nipple pain. And in their study, the topical treatment with lanolin was more effective than expressed breast milk for faster healing of nipple trauma and reducing nipple pain. So why do moms look for a nipple cream or a solution to their soreness in an application of a product that will help with their difficulty, their tenderness that they're feeling? And what we know is that moms do search. They search for products to help with soreness. They go on to Google MD, they hunt for products online, and they ask lactation consultants for advice. What can I use to either prevent and or to treat the product? And what they want is a product that is safe for them and their infant, that helps to relieve the soreness, that supports natural healing, and is 100% natural. These are issues that are important for mothers, and they look for products that will meet these criteria. So what I'd like to do is share with you some product information about Medila's highly purified single ingredient product, lanolin, called Purelan. This is a product that is free from additives, preservatives, and fragrances. It's dermatologically tested and proven safe for not only infants, but for moms' sensitive skin. It's hypoallergenic, has no smell and no trace. And it is the only brand actually that sources from mucilin-free farms. And what this means is that it is safe from removing the skin area of sheep with shears when it is actually the wool is removed from the sheep, which is where the Purelan or the product actually comes from. So it's a ecologically a product that is safe with animals as well. And the removal of that wool from the animals is safe. What's interesting about medical grade products is that they're tested to be a grade that's different from cosmetic grade products. What we understand is that other products or brands of lanolin that are available for mothers to use for nipple soreness and pain are a cosmetic grade. The Purelan product is a medical grade product. It has gone through extensive testing to guarantee its safety and its efficacy. And it has a dual action that creates a protective layer on the skin surface that rehydrates the skin, relieves nipple soreness while the skin heals naturally. And Purelan meets the European Pharmacopoeia standards, which is regarded as the highest and best industry standard and more stringent actually than the US Pharmacopoeia standards. And the key to relieving sore nipples lies in protecting and rehydrating the skin. And this is something referred to as water absorption capacity. The higher the water absorption capacity, the higher moisturizing properties and therefore more effective in providing relief to sore nipples and dry skin. Putting a protective barrier on intact skin helps to moisturize the skin. And I like to think of why we use lip balm in the winter helps us to protect us from chapped lips is similar as to this type of protection that is offered with the product. And due to its superior water absorption capacity, which is greater than 210%, Purelan can hold more than twice its weight in water, naturally helping the skin's rehydration. Purelan's rich texture creates a long-lasting skin barrier due to its high water absorption, locking in the moisture, thereby helping the natural healing process. So what management strategies can be suggested? I'm going to go over this as we're clearly coming up against a time barrier here, but we all can recognize that prevention is really the key in preventing sore and damaged nipples. It's the first line of defense or intervention, and it really highlights the importance of not only prenatal lactation education, but professional lactation support throughout the post-birth period. We need to supervise breastfeeding, and we need to make sure that correct positioning and latch is actually occurring. Moms deserve to breastfeed without having to suffer pain. In some cases, very significant, unbearable pain. And previous negative breastfeeding experiences and difficulties have a strong influence on breastfeeding initiation and duration for subsequent children. And our risk factors for not wanting to breastfeed another child again. I mean, the fear of potentially experiencing that pain and trauma again are risk factors for not breastfeeding a future child. So in addition to professional lactation support, the use of a highly purified lanolin creates a protective rehydrating layer on the nipple to help decrease the incidence of tenderness and soreness. And none of us can ever think about what happened last year without what's going to happen to our stats for 2020 when we think about breastfeeding rates in the US and around the world for that matter. We need breastfeeding education. We need lactation support to prepare mothers with how to deal with breastfeeding issues. And it's so important to let them know what to do, where to go to get the help, how to keep the skin supple and moist to prevent skin breakdown. So I'm going to end here with a short personal story. And it's because 32 years ago tomorrow, I gave birth to our oldest child, and I had a strong commitment to breastfeed, and I had great role models. My mom had breastfed, my two sisters had breastfed their children, and I was an experienced perinatal nurse, and yet I experienced severe nipple trauma that resulted in a less than ideal breastfeeding experience. Yeah, that handsome dude on the right is our Italian stallion. But I'd like you to think about what happens when personal lactation goals are not met. Moms may encounter emotional distress and even feelings of failure. And mothers like me may sadly relate stories of disappointing breastfeeding experience for months and even years later. Every mom deserves the best opportunity to meet her personal lactation goals. And given that nipple soreness and pain are common issues breastfeeding moms experience, intervening early, prenatally, and the initial post-birth period with education and lactation strategies have the potential to improve the breastfeeding experiences for a tremendous number of women. And I hope you can appreciate the impact sore, tender nipples can have on any breastfeeding experience. And I hope you can see value in not only quality prenatal education and strong lactation support, but how Medila's purified lanolin product, Purelan, can create a long-lasting skin barrier that improves skin integrity and positive breastfeeding outcomes. It's been a pleasure to be with you all today. I thank you. I'm not sure if we have time for questions, but I'd love to hear from you.
Thank you, Irene, for that great information. We do have a few minutes for some questions. Do you have the very last slide on the
Sure.
symposium?
Yeah. There we go.
Oh, perfect. Um, the first question that came in is, does Pureland need to be washed off before breastfeeding?
That's a wonderful question, is what moms would ask, actually. What do I need to do when I am using a product? And the answer to the use of purified lanolin that is Pureland product is no. It does not need to be washed off before breastfeeding.
Okay, thank you for that. The next question is Pureland organic?
By organic, I can tell you it is a single ingredient product that's highly purified. So in that sense, definition of organic, it is a pure product that has only one ingredient. And that's real important for families to know. It does not have any other additives to it. And so, yeah, definition of organic, you probably, we all might have a different definition, but this comes from that pure lanolin product. I mean, it is a pure lanolin, single ingredient product.
Okay, thank you for that answer. Someone was asking if samples will be available. I will actually find out and I will email everyone how to get samples from their reps if those are available. It looks like we're almost half past the hour. So a couple quick things before we wrap it up for today. Certificates will be available on Monday by downloading those, excuse me, from your accounts. And This webinar actually tied in pretty well with the webinar that we had last week on nipple shields. If anyone on this webinar today would like the link for that, please email education@medela.com and I'll be happy to provide you the link to that webinar from last week. And one last quick thing before we end this call is on the screen is the advertisement for our 15th annual Global Breastfeeding Symposium, Breastfeeding and Lactation Symposium, excuse me. And just a quick thing, the abstract deadline has been extended to August 7th, and anyone whose abstract is accepted will receive free complimentary registration. The pricing on this is about $70 US. It's $60 euro, so that calculates to approximately $70 US and approximately $90 Canadian. And that's a great price for considering you would get 6.25 contact hours. If anyone, again, needs any other further information, feel free to email education@medela.com and I'll be happy to provide that. And thank you again, Irene, for presenting for us today. And I wish everyone a great afternoon. Thank you.
Thanks, Kim.